Good morning, good afternoon, everyone, and welcome to another edition of Career Showcase with Digital Health Skills for Africa. My name is Izino Makwe, and with us today is Carol, and we're going to be having another interesting conversation around building your career in digital health in Africa. How do you get into this space? Who are those who have gone ahead of us in this space? How how is it to navigate in this space? We know that there is no clear educational pathway to digital health in Africa. And even globally, it's not so easy to just say go into school and study digital health and then come out and start working in a digital health space. So that's why we've created these conversations for us to have these talks with industry experts and find out how they got there and what's the shortcut to get there. So with us today is Carol Kamasaka, and I'm just going to do a brief bio and then we can get the ball rolling. And hello, Carol, and welcome to our show today.
Thank you so much, AC, and I'm very excited to be here and happy to speak to you about my career in digital health. Like AC said, my name is Carol Kamasaka, and I'm a digital health specialist, expert, and enthusiast. Been in this field for 12 years now of health informatics. I've worked with government entities in Uganda, Ministry of Health. I've worked with PATH. I've worked with JSI for both PATH and JSI. It was USAID funded projects. And all these projects were tied to digital health, were tied to how can we support governments, how can we support ministries of health to use digital tools to achieve universal health coverage. Most of my career was with the Ministry of Health in Uganda, and this is when I actually paved my way into the digital health world. Ministry of Health opened my world to digital health, to health informatics and information technology in health. There's so many terms we can give this field. Initially, it was IT in health, and it keeps evolving. But it is a career that I have enjoyed so much. It is an evolving that I've enjoyed so much, working with ministries of health, working with development partners, working with other government agencies, and quite a number of stakeholders, including health workers at all levels. Thank you.
Thank you very much for that amazing intro and the bio. And it's very extensive, and we can see how cross-cutting how rich your background is. And for the first discuss we're going to have today, your journey into digital health has been very robust, and of course, you could tell us full of surprises. So, what is one in quotes ugly truth that's about breaking into this field in Africa that no one talks about, and how did you navigate it? What's something that happens that was surprising to you, and we know that this happens and no one says or talks about it, and how did you navigate it?
So what I can tell you is that there is no shortcut. I heard you mention about shortcuts, and why I'm saying this is because I've seen biostatisticians, I've seen records personnel, I've seen IT personnel trying to break through into this field. But you just have to be a health informatics expert, a digital health expert, trained and inexperienced to be in this field. There is absolutely no shortcut, but I've seen it. And you go to places and you find people who call themselves health informatics specialists, but they have not trained in health informatics. There's actually specific training for health informatics, which translates you and introduces you to the field of digital health. So for me, this keeps surprising me. And to tell you the truth, if you came in and bumped into this field without that training of health informatics, you are definitely going to hit a snag at a certain point, because there's going to be concepts that you do not understand. There's going to be people that you talk to understand the field, and they'll be looking at you like, how did you get here? Because they do understand the field, they do understand the concepts. So at any one point, you're going to hit a snag. You're going to get onto a wall and you can't break through. So there's no shortcut in this field.
Interesting. So, there's something you said about training in digital health and health informatics. So, where can one get this training in Africa? And for people who want to get into this space and have a knack for it, people who have done self-study, how do they get in if they have to be trained professionally?
Thanks, AZ. And I'll take you back to when I hit that snag. I had my background in IT, had done my IT, my information technology at bachelor's, and then I got a job with the Ministry of Health. And there I was masquerading as an expert in health, in IT in health. And, but then in Uganda, it was first introduced at Makerere University at master's level. There's a master's in health informatics. So that's when I realized actually I need actual training in this field. And then I enrolled for the master's in health informatics. There's also Nairobi, the Moi University in Nairobi. They train in health informatics. Actually, the first cohort of health informatics specialists in Uganda did their training at master's level in Moi University, Nairobi. Then there's also in South Africa. So I think it's become so popular. It's become such a need in global health, a need for health informatics specialists in the field that major universities in Africa, if I think, I don't know if it's in Nigeria, but I'm very sure about South Africa, I'm sure about Nairobi and Uganda at Makerere University, that this training is being offered at master's level. Bachelor's level, it is still not yet there, but I believe we will get there because it's become a cadre that is very critical in global health.
Beautiful. And I just wanted to plug in here. I know Digital Health Skills for Africa did a post about trainings in health informatics and digital health in Africa. So you can go to our website or our LinkedIn page and scroll through that. I think people also contributed, oh, this one, our country has this program, our country has that program. So there's a lot of resource that people can go to access more information. Because I also remember that Zambia recently started a program in health informatics. So I think it's getting popular across the continent, and that's a very welcomed practice because I am one of the proponents of our curriculum is really outdated. People go to school, they don't have the skills you expect them to have. You come out and you have these jobs, and people are not trained for these jobs that you have created. Now, the new emerging roles that are coming out and they don't have the skills for these roles. So thank you for bringing that up. And I'm just going to shift gears a bit to your work in Uganda because we try to get to know a bit about the places guests come from and the kind of work that you do. So tell us a bit about Uganda's digital health policy landscape and where do you see the biggest gaps now and how can professionals in this space work with or around them?
Uh, the digital landscape in Uganda has evolved. We started with a siloed kind of implementation and tools in digital health with no regulation, with no guidelines. But over that time, as the field expanded, we put policies in place. We have a whole digital health strategy in place. We have guidelines for implementing solutions at all levels. We have guidelines for implementing specific solutions, be it health facility, be it community, be it pharmacy. Those guidelines are in place. And then we have a political will. We have strong buy-in from the top government leaders. We have our leaders who have actually embraced technology, who have embraced digital transformation. And it is even in the National Development Plan for the country, pushing it to the various sectors. So the digital landscape has stabilized. We have partners who come in and they align to the guidelines, they align to the strategies, they align to the goal that the country has. and there's no more siloed implementation. There's no more ad hoc implementation. It is all planned. There's a whole technical working group in charge of digital health where different stakeholders meet to discuss the way forward in terms of digital transformation in the health sector. There is a steering committee that is chaired by the permanent secretary, and the technical working group feeds into this. So there's no implementation that happens that does not reach the top of the sector and has been approved. There's a whole process of approving the digital tools that are introduced into the country. So our landscape is stable, and this has seen a lot of growth and a lot of a lot of acceptance and embracing of the data tools. However, we still have challenges, definitely. And the major challenge is in the capacity. We're still struggling with in-service health workers who do not have computer skills, even the basic skills of computers. So, and the human capacity building basket is so big. It requires a lot of funding to build capacity, especially of the in-service workers, those who are already in service and need to keep up. You're not going to fire them. No, you need them. You need these 50-year-old midwives who were born before computers even existed. So that is still a challenge. Then the other challenge is in terms of infrastructure. Talking about computers, they're very expensive. If you're going to equip the entire sector with computers and other gadgets to use in digital health, it takes quite some money. And also currently with USAID pulling out, which had quite a number of partners supporting these areas, it is an area that not just Uganda, but other countries are struggling with infrastructure development. Of course, even if you buy computers 5 years down the road, they'll be obsolete. So you need to upgrade. So that's to keep that infrastructure budget running is a big challenge. The other challenge that exists, and this is not just for Uganda, is having the digital health experts within the organization structures of these ministries of health. We have gone to school, we have trained, but we don't have jobs because these jobs were initially not put in the structures. So you have resources who are out there, but you cannot utilize them because they are not in the government structure. And this is when partners come in. But when projects end, that means that resource will also be leaving. So it constantly and continuously leaves that gap. Yeah. Okay.
Yeah, that's amazing. And that's I think that's something that cuts across a lot of countries because we can see the wave of digital health strategies coming back. I know during the COVID era, when COVID just came, we had a wave of digital health strategies being developed, and some of them withered down, some were not implemented, and we can see that coming back. And you can see the role that government will plays in implementation and the existence and the standardization of these projects. That's cohesion, reducing silos. So that's very important that these digital health strategies are being developed, and the capacity building that we keep talking about. It goes back to your first point about training, that it's very important that we get these trainings before people even come into the system, and also people who are already in the system need to be trained. And so that's something that I believe there are a lot of siloed training institutions. I think we need to really come together and say, what are the needs of these people and how do we train them? That's very important. And so talking about this health the government's being the government will. And yes, the government is working well, but then there are these public-private partnerships that happen in the digital health space. So we know that it sounds great on paper. Yes, working with private institutions to bring to life these solutions, digital health solutions. But also the data shows that as high as 90% of digital health solutions fail. So can you share any success story? I know you've worked with a lot of organizations to bring digital health solutions to life. So can you share any African private partnership, um, public-private partnership success story that's worked, and what is it that made it work?
Thanks, AC. I think this is a quick one. It's just in my neighborhood in Kenya. Um, Safaricom. Safaricom is a private organization, but they have partnered with the Ministry of Health to scale up digital solutions. And look at Safaricom, a telecom provider. It provides internet to mobile device holders. And through that, they are able to disseminate information. They're able to reach a mother in a local village with partnership, through that partnership with a Safaricom, but also to scale up digital solutions in terms of providing internet at a subsidized fee to the health facilities that are using these digital tools, in terms of zero rating the 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 digital health tools on the Ministry of Health domain. So I think that is one of the successful public and private partnerships that I have seen so far. And with what has happened and USAID pulling out of funding, we are going to be seeing a lot more of these private-public partnerships. I mean, the private sector has already moved ahead of us. They have already done these great things. You have the telecos, which reach the lowest of the levels in terms of accessibility to mobile phones. And they have rolled out digital solutions like what we call mobile money, M-Pesa, within our region, that my grandmother does not have to walk to the bank to transact to get money. I'll send them money and they'll walk to the nearest mobile money point and they'll be able to access money, or even go to the market and transact using their phone, because the money is on their phone, and the person they're buying from can actually take that money. You can send money to them without having to carry cash, without having to worry about the insecurities. So these same private entities can be able to disseminate information, can be able to support the use of digital tools through the mobile devices which they provide internet to. So I think the Safaricom and Ministry of Health partnership is one of the greatest partnerships that we need to learn from. And I know they're still implementing, but there's going to be lots of lessons to learn from this partnership that we can replicate in other African countries.
Beautiful. That's amazing. And I'm also thinking of what you're saying, that I'm also thinking of there's a lot we can learn from fintechs. And there's a lot of collaborations that can happen between the healthcare industry and the financial industry as well as what we can do for the telecom industry. Because
Mm.
internet is needed for a lot of health solutions to work. So if you can get leverage on that penetration that has happened with the telecoms, the basic things that can happen, like you just mentioned, all the beautiful things that the telecom industry has achieved. There's a whole lot. Telemedicine can go there's a lot we can do with telemedicine, and a lot of digital solutions that mobile solution that leverage on internet services. And this is care of the next question I wanted to ask about infrastructure gaps, because that usually takes, when you have this telecoms serving this purpose, that helps with addressing infrastructure gaps. But then also, is there a role that the government has to play in addressing infrastructure gaps, or other partners? Is there something we can do about infrastructure gaps? Because that's real, power cuts and the likes of them.
Yeah, I mean, it is the role of the government. Right now, we are talking about dealing without the major donor in the whole world globally. So it is the role of government to fix the infrastructure gaps. And I keep telling people that the same internet that can be accessed by schools can be the same internet that health facilities can access, can be the same internet that a farmer in the village can access. So it is a matter of the various sectors within the government to work together. And if they work together to provide these solutions, The costs will be lower. Why do I need Ministry of Health to pull a fiber cable to the health facilities and Ministry of Education pull another fiber cable to schools? These schools and health facilities are within the same vicinity. Why do I need Ministry of Agriculture to pull the same fiber cable to reach the farmers in the village? Why can't those three work together? Partner with the telecos, partner with any other ISP to pull that one fiber cable at the lowest of the resources available right now and reach everybody within the country. You see, when you look at the telecos, they have reached a farmer, they have reached a student, they have reached a health worker, they have reached a house help in providing internet. They are all targeting one person, and it is just one service provider. So the government can actually unite these sectors, and these sectors can work together instead of pushing all these resources all over the place, doing the same thing. These sectors can come together and address all these infrastructure gaps, because we need the same roads, we need the same electricity, we need its infrastructure for everyone, not different infrastructure for everyone. It is one basket serving everyone. I think for the governments to fix the infrastructure issues, there needs to be a lot of talk and a lot of over to you.
Oh, thank you so much. So, as you're talking, I'm looking at my questions and like this is addressing a lot of questions that I have because engaging stakeholders to align with digital health priorities and national priorities is just what I wanted to talk about, and you've already addressed that. And there's a lot of talk, but then you talked about strategies on how we can um in practice address these issues. And as we start wrapping up, what really for you is the next big thing in African digital health space? What are the trends you're betting on, and how can professionals in this space prepare for it without chasing the usual shining objects?
The next big thing is health data. I'll not just say data, but the next big thing is health data. There's so many tools that have been rolled out in our ministries of health, in our governments in Africa, and all these tools are collecting data. Where is this data? Who is using it? How are they using it? How is it governed? How is it secured? It is going to be the next big thing. And if we are not prepared with AI coming in, which is also another big thing, I wouldn't want to say the next big thing because I don't know how ready we are as Africa, or we are just jumping on the bandwagon of AI, but we are not yet there. We need first put a health data house in place, because if we jump on AI and bring it into our health data that is not properly governed, that is not properly stored, it is going to be a mess. We are going to have a lot of litigations because a lot of data is going to be misused. So the next big thing is data and its governance for Africa. So if I were out there looking to get into this field, I would go into data science, big data, health data governance. That is where I would be looking, because we need that more than we need AI. If AI finds our data that is the way it is right now, it is going to be a mess. We are going to have malaria data answering to HIV questions. Yeah.
So we shouldn't be quick to start building AI agents and
No,
Hmm?
no,
Those
no,
are
no.
so
We
many
need to first
objects.
manage our data. Yeah.
That's great. So that's really insightful because talking what I was saying, she's gonna say AI because that's like the buzzword now, and
Ah,
yeah, everyone is just talking about AI and agentic AI. I know there's beautiful things about AI, but that's refreshing to see this perspective of yours. And uh, thinking about leadership and inclusion, we about women, and is a conversation that happens in the workplace a lot about women being the backbone in healthcare. You see us a lot in working, I mean, women represent a higher percentage of healthcare workers in Africa. And but they're represented in digital health leadership. In fact, in Africa, in healthcare leadership in whole. So what are some barriers that you have experienced and you have seen? We have documented barriers, but what have you experienced and what have you seen? And how do you think we can solve this and how have you navigated this yourself?
I'm going to tell you one thing, and it's we are our own barriers as women. We have very many women who are fighting for women's rights, but when one of us gets there, they want to be the only one who are there. So we become our own barriers. Then, on the other hand, you can become your own personal barrier because you think, oh, I'm a woman, or we underlooked, or so you stay in the back. When you go to boardrooms, you're the one who wants to sit behind. You're the one who wants to sit in a corner. You don't even want to be asked a question. These are things I have actually realized later in my career that I was actually my own barrier. Excuse me, pull that chair, sister. Pull it to the table in that boardroom. Put your hand up. There's many times when your hand is going to be up and you're going to speak, and they'll be like, she's just a woman. She's being emotional. Do not stop talking. Do not stop putting that hand up. Eventually, your emotions will be considered. Your emotions will be listened to. We are women. We speak from an emotional, like we speak with emotions. We don't want to hide our emotions when we speak. But along the way, those emotions are going to be considered. So you're going to be in those rooms. You'll speak as a woman and no one will listen to you. You're going to enter rooms where you are the only woman. Even right now, where I am, I go to meetings, I go to gatherings, and I am the only woman speaking about digital health as a woman. But don't give up. That's all I can say because these barriers will not end. I, there's so many advocacy for women. It has been there. People have been advocating for women since I was a child, since I was 10, advocating for girl child education, advocating for women to be on top in top positions. These advocacies are still there, but it takes you as a person to actually realize that this is you. You need to unmask. You need to get out of that hole, that shell that is shielding you and speak up. Men speak up, by the way. They speak up. Men speaks. They mean it. So it's up to us as women because no one will ever fight this. We are the women fighting this part ourselves. There are very few men who are our allies and speak for us, but there are very few. There are very few. So it's up to you as a person, as a woman, to speak for yourself, to put your voice out there and be heard. Because once these women get up there, they'll forget about you. They'll forget about you, and because they want to be the only ones there. We are our major barriers. We as women are our biggest barriers in this sector. If we had more women who are hand holding, be somewhere, we would. But through speaking, through being present, I have made it. I've broken through. And I mean, when you in this country in Uganda, when you are looking for women who have experience in digital health, I'll be the first person they mention. I can confidently say that because I have not given up. I have not cried when I was not listened to. I've not cried when my ideas were trashed. I've not cried when the position came up and they gave it to a man and not to me. No, I haven't. I kept moving and talking and speaking. Yeah.
That's really helpful, and thank you for sharing that with us. And talking about building yourself and being very sure with yourself, um, and also bringing up others. What we do here mainly is capacity building and lifting others as well. In your own way, how do you, and earlier we talked about capacity building for in-service workers. This is a very crucial topic. whether you're building soft skills or building hard skills. So how do you propose that this capacity building be done actually for long-term success?
I think the major thing is to first understand what gaps, because there are different gaps at different levels. You need to first understand that people do not have computer skills to be able to use these digital tools. And the people I'm talking about are the health workers who see the patients. But also you have to keep the patient at the back of your mind. You do not want a patient to come to a health facility where you have pushed these digital tools to health workers. And because the health worker is not able to use a computer, they're hiding away. There's no doctor in the hospital because they can't use a computer. They'll feign sickness, they will take leave, and your patients are going to suffer. At the end of the day, we are all aiming at serving the patient, taking care of the patient. So the first thing that needs to be addressed is that gap in ICT, the ICT gap that exists within our health workforce. It is there. I can tell you this. I have seen it with my eyes from experience. It is a major gap that needs to be fixed. The other way to address capacity is, you see, these health workers, they have their way of doing things when they're seeing patients. I think it's high time that technology developers worked with healthcare workers to develop solutions for the health workers, not developing solutions that they think the health workers need. When you develop solutions with the health workers, through the development, you are building their capacity. And when these solutions come to them, they'll be excited. It will be like their own. They're like, oh, I took part in this. Actually, I told them to do this. They have done it. It will solve a lot of capacity gaps because now you are developing for them. Tech developers need to start working with healthcare workers when they're developing these solutions, because they do not, the tech developers do not understand the health programming. They do not understand the patient journey. They will just assume that, this is how it works. I mean, patient enters the hospital, they see a doctor, they get a prescription and they leave. There's a journey that the patient goes through, and who knows about this journey more than the healthcare worker? So I think that would address a very, very major capacity gap that exists, because these solutions are thrown in and it's like, this is nothing like I do every day. This is so different. And then they have to adjust, and then time goes, and then patients are lining up because the healthcare worker cannot navigate this solution. And you have to take them away to build their capacity. How about the patient that they are supposed to see? You get where I'm going.
Yeah,
So all these gaps can be addressed if we work together and understand that, one, our client is the patient. They'll be very sick. They will not have time to come and wait. They could die, or they could go to the next hospital. Secondly, tech developers need to come together and work with the health workers to develop the solutions that healthcare workers know how to use best to serve their client, who is the patient.
that's amazing. So co-design is very important in
Yeah.
this bit, so that we don't put a square a round ball in a square hole. So that's these things are.
Mhm.
Thank you so much for this engaging conversation we've had. It was. Do you have any last words for viewers and those who are listening to us? Any last words for us before we wrap up for today?
Um, My final words is to encourage everyone out there who is looking to join this field. It is a very exciting field. It is a growing field. There can never be enough resources, and I do encourage the women, especially. It's it's a fulfilling field. I mean, you develop a tool that will help a patient. How fulfilling can that be? So I encourage you, do not give up when you go to those meetings, to those boardrooms, to those conferences. Speak up, connect, and network. there's so many resources out there that are willing to hold your hand to see you succeed in this field. Thank you so much.
Thank you. And I wanted to say initially, and I forgot about this, congratulations on a very successful outing with the Helena Scientific Conference that was held recently in Gaborone. And I'm so grateful to see Helena doing amazing things. And kudos to you, your work and the team for bringing that to light and bringing all the beautiful things I've seen Helena doing. So thank you so much for having this conversation with us. It's been very enlightening for me, really, that I've learned a couple of things from this conversation, and I want to say thank you to you for being with us, for coming on this program, and we hope we can have further discussions. And people, you can reach out to Carol. I mean, you can follow her on LinkedIn with her name Carol Kamasaka on LinkedIn, and engage with the post that she makes there. So thank you, everybody, and see you next 2 months when we have these conversations every third week of the month. And this is goodbye from us. And thank you once again, Carol. And see you guys next time. Bye.